Yeah, physical therapy is actually a very huge field. We just kind of, for example, we're working in the geriatric field right now with a nursing home, skilled nursing, and hospital. It's basically focused on a lot of functional mobility, how patients get up the bed, get in the chair, how they walk and how they function in the community. That's how it basically works just for geriatric population. But there are other fields like sports medicine, for physical therapy. There are pulmonary physical therapy, many others, like different fields we're working on.
And occupational therapy focuses on the everyday occupation. So in this field of geriatrics and rehab, we focus on getting people back to doing their dressing, their bathing, their cooking, cleaning. If they enjoy gardening, anything that is a meaningful occupation to them, we try to get them back to that independent level of doing. I enjoy what I do because I enjoy the gratification that I get from the residents that I work with. I enjoy seeing people coming in and not feeling so great, and then when they leave, they actually have a really good appreciation for having me get them up and get dressed and take showers and all those little things that they normally would take for granted. They now realize how important it is and how much work goes into participating in tasks every day. So I enjoy seeing them going home and being independent and saying, okay, I just had heart surgery or my hip replaced and I thought this was going to be really hard, but it wasn't, and you guys made it possible.
For me, I enjoy my job is basic for patients when they get better, because they're really not good coming from the hospital. When they get better, they're actually walking. For physical therapy, that's a major part for us, how to work with patients. They get out of the bed, they start walking. The first day they say, oh, I'm walking right now. I haven't been walking for the past 2 months. And that's, really gratification from the patients, make you feel like, you're really valued for your job, and as working in a nursing home, we always work with the geriatric patients, especially for your elderly. You really want to help them. That's a major thing why I'm working in the field.
The most challenging part with occupational therapy is explaining the difference between occupational therapy and physical therapy, because a lot of people come to rehab centers like Lorien facilities and say, I want physical therapy, I want to walk. And they don't think that it's important to work on their cooking or it's important to do their laundry tasks, because once they walk, they can do it all. So for me, working with people with different personalities and getting them to understand that it's important that they do all these things in addition to walking, then that's the most difficult part, because they don't always see it as there are multiple aspects of their recovery.
Yeah, my challenging part is that most people think physical therapy is just walking, just doing exercise. So sometimes when your patient don't feel well, they were thinking you're going to take them down there, do like a, strenuous exercise there. I don't feel like it. I don't need exercise. I don't do exercise at home. But that's not the point. Our job is actually physically get you better. It's not just about exercise, not just about the walking. It's the part how to get you start moving, doing things you were doing before. I think it's the major challenging, especially for elderly. It's like, I don't exercise at home. What am I doing here? That's the main thing.
Lorien companies all around have you do Silverchair learning experiences, which are monthly online websites that every single person who works in the Lorien building or comes in to help has to take these online courses and a test every month. So that kind of covers all the basics of dementia care, fall risks, nutrition, anything that needs to be covered or that takes place in a Lorien facility, that's covered in those Silverchairs. And then within the Lorien Rehab Department, they offer CPR courses, continuing ed courses, and they constantly let you know aware of if people are coming in to do in-services and whatnot. They're open to allowing anyone to gain professional competence.
That's pretty much all the training we have. And especially for physical therapy, we do use a bionic leg here, which is specialty for physical therapy use, help patient walk. It's like a robotic leg helping patient walk. So we do have in-service on that, get a certificate for that so we can help the patient when they need to get up walking. It's like a supportive equipment to help them.
Lorien's flexible. They understand that you work your 40 hours a week or whatever you work, and then you do have an outside life. And it's all about, especially in our professions with rehab, it's all about like a well-balanced life. So they do understand that when people need vacations and people go away on weekends and whatnot, they do understand that that's an aspect of life as well.
Yeah, our schedule's pretty flexible, as long as you make your day work, because we're working with human beings, so schedule got to be flexible. Yeah. So weekends, sometimes we work weekends, make up during the week, or just week of 5 days a week, Monday through Friday. So it's pretty flexible.